Is right. The medical community is debating whether or not men go through something similar to menopause in women as their testosterone levels decline. It's called menopause, and Tram has had a ball talking about this over the last couple of weeks. But this is a serious deal, right? So joining me now to talk about it is Dr. Sonal Haerter with Dignity Medical Group. Thank you, doctor, for being here. I appreciate it. So is menopause a real thing?
So menopause is not a medical term,
Okay.
but there is something to do with the decline in the testosterone levels. Menopause was first coined by a physician in UCLA, and then Time magazine used that term in 2014. But what it essentially means is decline in the levels of testosterone. Now, menopause or decline in testosterone is not as dramatic as menopause in women. So in women, there is pause on production of any female hormones. That's not the case in men. It's not dramatic. It's a slow decline in the levels of testosterone levels. And what that means is after the age of 40, there's about 1 to 2% decline per year in testosterone levels as men age or get older. But it's so subtle and it's not as dramatic. So only 10 to 20% men actually experience the testosterone decline. Most men actually do not have symptoms.
So when you're talking about menopause in women, you know, it'll be over the course of what, a year to 3 years or something, but they'll see dramatic heat flashes sometimes and a dramatic decrease. So what are some of the, if you do have menopause, how does that manifest itself if it's more, you know?
And some of these symptoms are similar, and actually women have it between 5 to 10 years. So for men, those symptoms are excessive fatigue, some sexual dysfunction. Those are the symptoms that actually initially most men present with. Loss of libido, change in sexual desire, muscle mass problems, so losing some muscle mass. Also hot flashes are not uncommon. Mood changes, sleep disturbances. So those are kind of similar to what women go through when they're going through menopause.
Okay, so let's say I'm 60 years old and I'm down, it'd be like 20% in my testosterone, right? You said 1% a year?
1% a year, yes, about 1%.
All right, so if I'm feeling those sorts of things, can I get treatment, or is it something I have to deal with?
Absolutely. So treatment number one is men actually who have healthy lifestyle do significantly better. So let's say your weight is optimal, you're not overweight or obese, you're not drinking excessive alcohol, you're not using tobacco or smoking products, no diabetes, no blood pressure medications, you will likely not have any symptoms of testosterone deficiency. But if you are experiencing, blood test is an easy way to find out if there is testosterone deficiency.
With who? Do you just go to a clinic and say, I want a blood test for my hormones?
Absolutely. You can go to your primary care doctor, and you need 2 rounds of low testosterone levels to confirm deficiency along with some symptoms. And if that's the case, you can actually get on testosterone replacement therapy or testosterone treatments as long as you don't have any contraindications.
And are there problems with that testosterone treatment? I mean, are there side effects or anything you have to worry about?
Absolutely. You have to monitor your prostate enzyme levels because sometimes it can increase your risk for prostate cancer. You have to maintain your blood count also, like a test that we do for blood count. So there are some symptoms and side effects to testosterone, treatments. So very important that this is medically supervised by whoever is giving the treatment.
Okay. Do I look like I'm going through menopause?
Absolutely not,
sure?
Troy. No, not at all. I mean,
Tram?
I just saw the biceps.
All right.
Troy.
I got some of this going.
Okay.
Thank you, doctor.
Of
Appreciate
course.
you coming
Welcome.
Yeah, Tram's been, I did that for Tram because she's been talking about menopause for the last 2 weeks.
Because we are not the only ones who go through a change in life, right? All right. Sonal, thank you.